just want to say I'm very pleased to rise today and speak about the member from Niagara Falls motion, which he's just raising awareness on on behalf of his constituents in the Niagara Falls area, but also raising awareness throughout the province on wait times. He's focusing on MRI wait times for not urgent emergency care where people have maybe been in a car accident or fallen down, but still nonetheless people are in terrible back pain and knee pain and hip pain, and they need those MRIs whether the minister feels that it's absolute urgent or not. The provincial mandate right now by this government is 28 days to wait for an MRI, and we're hearing that in Niagara Falls that wait is 114 days and months to wait for an MRI. The member in Nickelback spoke about Northern Ontario, how they're waiting for months. I just want to mention that when governments talk about investing in health care, they often talk about increases in investment in health care. But where that money went and whether it went to increase spending on MRIs is quite another story. We hear billions of dollars invested in actual buildings. Well, buildings don't provide health care. They provide the place to provide that health care. Billions of dollars to build a hospital, yet oftentimes there isn't the $1 million to buy an MRI machine. The hospital is told through its foundation, fundraise, raise the parking rates. That's why we saw such an increase in parking rates. It wasn't that the hospitals were greedy. They were trying to buy things like MRI machines for their hospitals. Many hospitals have new wings that, to tell you the truth, Madam Speaker, are empty. There are rooms that I have seen in hospitals where there should be MRI machines, and they aren't. They're just empty rooms. So what are we seeing? We're seeing more money spent on bureaucracy. Just this morning, Bill 41 was passed by this government with support from the NDP. Our caucus, the PC caucus, did not support it. And in my opinion, Bill 41 risks the privacy of all Ontario's patients and increases the bureaucracy in cost and more inefficiency. And we're going to see doctors, frontline healthcare workers, spending more of their time doing administrative work instead of spending time with their patients, actually providing the healthcare that's needed. So we're paying for bureaucracy, we're paying for buildings, but people are saying they're not receiving the health care that they provide the tax dollars to buy. So I think a real reset needs to be done, a real rethink, and we need to focus on outcomes, patient outcomes, because that's what health care is about, Madam Speaker. It's not about giving people MRIs because they want an MRI. It's about giving people the tests and the treatment that is required so that they have a better quality of life. That's really what it comes down to. Not just to lengthening their life and they're hooked up to machines, but to provide timely care so that they don't result in having to need sometimes even more expensive procedures because we've prolonged the wait times for them to have a test in order to provide the right care. So let's stop spending valuable healthcare dollars on bureaucracy and just structures, and let's get it into frontline healthcare. Thank you very much, Madam Speaker.
Thank you. Thank you.